Hi, so I'm going to be doing my catheter and Foley video. Okay, so first things first, when I walk in the room, I'll identify myself and then identify the patient with 2 identifiers. I'll ask their name, date of birth, to make sure it's them. I'm going to verify that my provider has the right orders and then why I'm doing this in the correct patient and so forth. I'm going to assess for pain and allergies. I'm going to assess for shellfish allergies. I'm going to assess for chlorhexidine allergies, iodine allergies. I'm going to assess for latex allergies. But latex allergies, we don't really use latex gloves, so it wouldn't really matter with it. But anything else latex, I'm going to just make sure they don't have a latex allergy. So first things first, we're going to make sure that we provide privacy because this procedure is a very uncomfortable procedure and the patient's exposed, and you want to make sure that they're comfortable and feel safe while you're doing this procedure. So we provide privacy, and then we for sure want to make sure that we are doing hand hygiene and make sure that we're clean because this is a sterile procedure, and you want to make sure that we are being safe for the patient and not giving them any sorts of bacteria and infection. Okay, so what we'll do first is that we'll raise the bed to our hip level because it's a sterile procedure and we want to make sure that's within our sterile field and we don't want to break our sterile field. Then we will have our patients put our knees up flexed. So these are our knees right here. So they'll be up flexed like so. And then we'll have them put their knees together and the ankles together. And then we will have them butterfly out and what's comfortable for the patient. And then I'll keep them in that position. While I'm having them get into that position, I will make sure that I'm telling them why we're doing the catheter. It could be for like a spinal injury or so forth that they're not able to get out of bed and they have to be in a catheter. I will tell them that if they have any questions during the whole procedure that they can let me know and I will answer any questions that they have. And then I will tell them about whenever we remove the catheter, about why we're removing it and that we don't want the catheter in for longer than it has to be because it can cause infections and so forth. So we want to make sure that is clear to the patient. And then we want to make sure that we're going to tell them that we're going to clean the perineal area to make sure that it's safe and clean and won't have any signs for infection for our procedure and when we turn the catheter in. So we do want to make sure we have verbal consent for what we're doing and make sure we have verbal consent that we can expose them and so forth. So once I had my patient flex their legs and put their ankles together and then butterfly out with their knees, I want to make sure that I'm assessing for any kind of bladder distension, any perineal redness, breakdown of the skin, any type of cuts, bruises, open sores, or anything that would make it very uncomfortable or cause infection for this catheter that I am putting in them. Make sure there's no rashes or anything like that, because if you have bladder distension, it could be very uncomfortable whenever you have the catheter, and quite possibly you won't be able to put the catheter in. So the patient is up there supine, laying on their back, knees flexed, and ready to have their legs fan open outward for the procedure. So when they're outward, that means like their sides of their feet are down, their ankles are going to be facing up. It's going to be like a butterfly, like butterfly's wings, so they're having out. Okay, so I'm going to make sure I put down one of the side rails of the bed so I can reach and to my patient. All right, now I'm going to do this. So now I'm going to get my my catheter kit, and I'm going to put it on a clean surface. I'm going to put my kit in between my patient's, well, not yet. I'm going to open my, okay, never mind. Scratch that. I'm going to get my catheter kit. I'm going to put it on a sterile, clean surface for my opening of it. So then I'm going to open it. I'm going to put, open it this way away from me and then open my sides. And then I'm going to open toward me. And then, okay. Whew. And then next what I'm going to do is I'm going to don my sterile gloves. Usually when you don your sterile gloves, you're not supposed to do this on your sterile field. You have to do it away from your sterile field, but I don't have room. So I'm going to do it right in front of me. But I want to make sure that they know that I know that I'm not supposed to do it on a sterile field. Okay, so I'm going to don my gloves. Then I'm going to scoop. I scooped in right here is what I scooped, so it's still sterile when I scoop in. And they're on. Sterile. All right, so once I put my sterile gloves on, I'm gonna know that I'm gonna keep my dominant hand as my sterile hand. I'm gonna use my non-dominant hand to help hold the catheter and touch my patient and so forth. Okay, so I have my sterilization, my kit, and I'm gonna move my kit in between my patient's legs so I have more accessible room to insert my catheter. So next what I'm going to do is I'm going to inform the patient that they're going to feel touching on them whenever I expose them, that I'm going to start to clean their perineal area. Actually, let me make sure I put my sterile surface on. Make sure I'm only touching 1-inch margins throughout it. I'll put that underneath the butt. All right, now I'm going to inform my patient that we are going to clean the area. I'm going to put iodine into cotton ball soaks, and then I'm going to clean the perineal area with my